Hi, everyone. Thanks for joining us tonight. We'll get started in about 5 or so minutes. Wait for some other people to log on. Okay, we can go ahead and get started. Thank you, guys. Good evening and welcome to You Do Not Have to Take No for an Answer, resources for overcoming insurer obstacles to mental health care, which is brought to you by NAMI Cook County North Suburban and Joe Feldman, the founder and president of Cover My Mental Health. So Cover My Mental Health is a not-for-profit, first of its kind resource dedicated to empowering individuals facing insurer obstacles with no cost, actionable resources and game plans when faced with denials of care, inadequate networks and barriers to fair treatment and access to mental health care. So my name's Courtney Hall. I'm the Adult and Family Programs Manager at NAMI Cook County North Suburban. Just a little bit about NAMI. So we are the nation's largest grassroots mental health organization that provides public awareness, no-cost support, and education programs online and in person so that people and families affected by mental health conditions can build better lives. We are a lifeline to individuals and families who don't know what to expect. We offer classes, support groups, and do a lot of advocacies for mental health Our programs are free and open to those in our community service areas. So this year, each month, mental health professionals will dig deep into a variety of topics to further educate us on our community members' topics of interest. So during this workshop, we will learn about common insurance company obstacles to mental health and substance use disorder care and specific tactics available to overcome those obstacles. We will also learn about potential actions that can be taken to push back against insurance company obstacles that are not revealed in insurance policies and may provide more timely results than formal insurance appeals. And finally, we will learn about the important support available from friends or family members, from employers, and from government towards overcoming insurance obstacles. Success stories will also be shared by patients and clinicians. Our Q&A will be held at the end of the presentation. However, if you'd like to type questions into the chat box or the Q&A box during our conversation, please feel free to. So our guest speaker tonight, Joe Feldman, began advocating for access to mental health care after overcoming denials for his adolescents' residential care, including with a successful federal lawsuit. Joe established Cover My Mental Health based on his own success overcoming insurance obstacles, with input from leading litigators, appeals experts, clinicians, insurance regulators, and former insurance industry insiders. Cover My Mental Health's resources have been presented to advocacy organizations in Illinois, Georgia, Texas, Maryland, Connecticut, and New York, to clinical organizations including UT Health Houston, Linder Center of Hope in Ohio, Manager Clinic, Silver Hill Hospital, Norton Healthcare, to clinical conferences hosted by the American Psychiatric Association and the National Council for Mental Wellbeing. Cover My Mental Health has been featured in numerous clinical and mainstream publications, as well as on television news in Cincinnati, Philadelphia, and Michigan. So we're really thrilled to have Joe here tonight to further educate us on this ever important topic. So I'm honored to welcome our guest speaker, Joe Feldman.
Courtney, thanks for that kind introduction, and welcome everyone. So as Courtney described, my goal this evening is to introduce you to the resources of Cover My Mental Health. And true to the title of our workshop tonight, you do not have to take no for an answer. I'd say my goal really is that you come away from this, from our discussion, believing that in fact you do not have to take no for an answer, and that there are steps that are available to patients, to family members, and to clinicians to overcome insurance obstacles, and to do so beginning immediately, and to do so in ways that the insurance company does not readily make obvious to you. I've included a comment in the chat. If you have interest, please feel free to drop a note in the chat with any questions that you may have, either during the course of the discussion, or if you have any questions that you are hoping that we cover tonight, and you want to make sure that I am aware of those, please feel free to drop them in the chat straight away, and we'll certainly have time for a Q&A at the end. As Courtney described, I got involved in advocacy when one of our kids needed more care than we were successfully able to find at home. And so on the recommendation of a psychiatrist, we found a residential program that provided a higher level of care, more intensive, and candidly just more appropriate for our kid, for our family. And as that program was beginning, we got a message from our insurance company that they were not going to pay for it, that it was not medically necessary, which is a phrase you'll hear a little bit about tonight. So we knew that they were wrong. We knew the care was medically necessary. And so we used our savings to pay for the care, and you could say deal with the insurance company later. We filed one appeal that was not successful, and eventually we filed a federal lawsuit, which we won, and then the insurance company paid what they should have paid for in the first place. What I'll share with you this evening are a number of approaches that can be taken that are far, far away from filing litigation. So litigation is a terrible way to go. It's time consuming, it is not quick, and it's simply very tough to enforce your rights as a member of a health plan. So we'll talk a little bit about other ways that you can push back that don't involve anything close to that. But the reason I started covering my mental health at the beginning of last year is that I don't want families to go through what we did, which is having an insurance company stand in the way of care for our family. So if we were to pause and think about our health insurance and what we expect, which, by the way, I'd say most people don't, because for the most part, health insurance works reasonably well. But if we were to stop and think about it, we might think about these expectations. We might expect that the insurance company is going to help us find an appropriate clinician. And we'll talk about what appropriate means. I'm talking about a network directory that gives us access to a number of clinicians that have certain characteristics that are important to our accessing care. And second, we would expect that it'd be really easy to understand what insurance is going to cover or not cover. And I'd say that the punchline is we would expect that the clinician who's taking care of us, who the insurance company helped us connect with, is going to be the person who decides what care we need and therefore what care is covered. We would also expect that as we progress through our treatment, maybe at higher levels of care or different levels of care, that care would be covered by by the insurance company. And finally, we would expect that the claims are going to be paid. We understand that there'll be deductibles or copays, but we would expect that we'll submit our claims, or the claims might be submitted even by our clinicians, and that those claims are going to be paid on a timely basis. We would also expect if there's some dispute about what claims are or are not going to be paid, that there'd be a straightforward way to resolve those disputes, and that those disputes would be resolved with the patient in mind, because after all, they provided us with a clinician who's competent, who has determined a course of treatment, and so if there's something that's amiss, we would expect that it's going to be very straightforward for us to deal with the insurance company. So sadly, if it worked that way all the time, we wouldn't be here this evening. What we know is that that obstacles arise in a variety of different ways, and we have to find different ways to push back and overcome those obstacles. So Cover My Mental Health has estimated that every year between 15 and 22 million mental health claims are denied by private insurance companies every year. And that's just simply too much. It's just not appropriate for care to be denied to people who purchased insurance expecting that it was going to be paid. So the resources of Cover My Mental Health are accessible on our website in a way that we hope is easy to navigate. We certainly look for ways to improve the navigation along the way. I'll show you, I think, maybe one other small screenshot from our website, but this is a picture of our homepage. The first thing that we try to provide is encouragement. Encouragement that, as the title of tonight's workshop goes, you do not have to take no for an answer. Because at the end of the day, having encouragement is, I think, the first step to believing that you're going to be able to overcome these obstacles. So if you haven't had a chance to visit our website, there's a QR code that would take you there straight away, and I'd certainly welcome your having a look at it after after tonight's remarks are finished. So the website is organized, I like to think, in a very common sense sort of based way. So as I mentioned, the first thing that we provide is encouragement, that you don't have to take no for an answer, and we've got steps that you can use to get started. Encouragement that the obstacles that have been placed in the way are appropriate for you to overcome and can be overcome. We have a section on tips for success, and I'll share a few of those in just a couple minutes. And then we really try to focus on what's the obstacle and how do you best engage the insurer in overcoming that obstacle in a very sort of common sense way. And then there are a number of different steps that can be taken to overcome those obstacles. We'll talk about an insurer complaint. And then as shown on the right-hand side, we'll talk about some resources that may be available to you to help you advocate, either from government or perhaps from your employer, as well as steps that can be taken if at first you don't succeed. Because what we know is that there's no guarantee that overcoming an insurance obstacle is going to be easy to do. What we do believe is that our resources will even the playing field. And what we hear from, especially I'd say clinicians, but also some patients and families who've used our resources, is that going into a conversation with the insurance company with a level of confidence and with a very common sense approach, that you are more likely to get the coverage and the commitment to cover that you would expect than if you didn't know how to ask the questions and so on. So we'll talk a little bit about, I'll say, some key ways to ask the questions and assert your rights. So on our homepage, you'll find a link for how to get started, and there you'll find some tips for success. And I want to mention just two of those here. The first is tips for how to talk to insurance company customer service reps. And there are a number of different tips that we provide here. Two that I'll mention are, first, always take notes. So just write down who you've talked to, what the date is. I always like to ask for their ID number. Sometimes they provide it immediately. Sometimes they hesitate. So I usually just say, I say usually because I've sadly had challenges with insurance companies on multiple occasions that has helped me to learn a little bit about how to provide some help here. When they tell me that they don't provide their number, I just remind them that in fact I know they will, and I'll just wait for it. And then they very typically just provide me the number, and they tell me they really shouldn't, but I know they absolutely are empowered to do that. The second tip when talking to an insurance customer service rep is to not have any conversations about clinical status. So our website has a short video. If you have a chance to look at it, I think you might find it a little bit fun. It's a video that talks about what to say when an insurance customer service rep says, for example, about say a family member, by the way, how's the treatment going? And the answer to that question should be, I think we'll leave that to the clinicians. Customer service rep is not, it's not appropriate for them to be asking questions about clinical status. And as they say, anything that you say can and will be used against you. So there's no reason to respond to that question. Better to defer and say, we'll let the clinicians take care of that. The second tip that I wanted to mention is the second one, support from a friend or family member. So when a family's in the middle of a mental health or substance use disorder crisis, it's very difficult to know what to do, and having any sort of, I'll say, additional work associated with dealing with an insurance company can just be more than you can handle. You need one more project like nothing, right? So every health insurance policy or every health insurance website has a form that you can download that you can use to authorize someone else, say a friend or a family member, to act in the same way that you can. So you're not handing over responsibility separate from yours. You're adding someone who can speak for you and ask questions of the insurance company or follow up. It turns out that this might be an extremely useful tip. And I've had dozens of clinicians, when I have described this in webinars to clinical groups, tell me how helpful it is for them to be able to say to their patients that there's a resource called covermymentalhealth.org, and also there's a resource on the website where you can authorize someone else to act for you, so that in the middle of all your challenges of dealing with someone in your family who might be in a crisis, you can have someone who you trust, could be a friend, family member, neighbor. There's no limitation on that other than it can't be one of your clinicians, and they can speak for you and get information or follow up with the insurance company. There's some other tips on the website which you can access and have a look. So let's talk first about the expectation of being able to identify an appropriate clinician. So what does appropriate mean? So there are really three characteristics that I think are relevant to this point about expecting access to an appropriate clinician. First, that they have the relevant expertise to help in this situation. So if you're looking for someone who has experience treating anxiety and depression, you would expect that they would have that kind of experience. Or if it's something more specialized, like say an eating disorder or OCD or some other concern, you would expect the clinician to have that relevant expertise. It's just normal. In the same way that if you had diabetes, you would expect to be able to go to a clinician who understands diabetes. Or if you have a heart condition, you would expect to be able to go to a cardiologist. The other two characteristics are that you expect that clinician to be close to you. So, and you expect to be able to get an appointment soon. Now, close and soon may be specified in your health insurance policy, and they also may be specified in the state that you live in. So it could be specified in Illinois, there's some specification for what soon and close mean. But for our purposes, I worry less about exactly what close and soon means, because I think you'll know it when you see it. So close, if you're living in downtown Chicago, say, close could mean a drive of, let's say, 5 miles. Whereas if you're living in a location that's not in the city, but is out in the, let's say, out in the countryside, in a rural location, you might expect to be able to drive 20 or 30 miles, because that takes you about as long. So close can mean by time or by distance, but you'll know that it's not 300 miles away. And when it comes to soon, you'll also know that it's not 3 years from Thursday. If it's truly a medical emergency that can't wait, you would expect that it's today. And otherwise, you would expect that an appointment should be available within a week or two. The point is soon and close with the right expertise. And you should be able to use the network directory that's available to you either online or possibly accessed through a customer service rep to be able to identify potential clinicians who meet these three characteristics. And what we also know is that these network directories are notoriously unreliable. And when I say notorious, it doesn't mean that they're useless. It means that people who have done studies of networks have found that there's any number of reasons why individuals listed in the directories may actually not be available soon and close and with the right expertise. So it could be that when the clinician decided to join the network, they checked a bunch of boxes of areas that they have expertise in. And they might have checked a box that said they are expert in eating disorders, but it turns out they actually aren't. They might know something about it, but they're not able to treat. It can also be that they're no longer in the network, or it could be that they're not taking new patients. And there were other examples where the clinicians who are listed in the directory have retired or maybe even are deceased. So on the website, you can find this worksheet that can be downloaded to essentially show your work, that you've done your job. You use the network directory to identify clinicians who would appear to be with the right expertise and available close and soon, and to be able to document your search. The idea is, if you have done your homework and have used this worksheet to be able to document that you've done your work, it's going to make it much easier to go back to the insurance company and say, so I've done my work, and now I'm asking that you do yours, and either find me a clinician who somehow maybe I haven't been able to find, who has the three characteristics that matter, or you can grant me a waiver so that I can access clinicians who are not in the network directory, but I'll pay no more than if they were in the directory. So this is a worksheet that might help you to organize your documentation of having kept your side of the bargain. Let's talk about the expectations of what's going to be covered and what's not going to be covered. So if we were to stop and think about this, our expectation would be that we're not going to be surprised. That's, I think, the simplest way. we would expect that the clinician who we're working with is going to have the most timely and specific information for our care, and that as our treatment continues, assuming that it's not just I'll say a single appointment, that the clinician who is taking care of us, and maybe that's someone that we've been referred to, is going to have the best information about what we need, and through the entire course of our treatment, that care is going to be covered. Now, as I mentioned at the beginning, when one of our kiddos was in this residential program, and we got the message back from our insurance company that the care was not medically necessary, so that would count as a surprise, because we were quite clear, and the clinicians who were taking care of our kiddo also knew quite clearly that the care was definitely medically necessary. So how does it come to be that an insurance company gets it wrong? So this chart is I'll say, a representation of a conversation that I had last summer. I was having dinner with a real friend of Cover My Mental Health, Andrew Gerber. He's a psychiatrist who runs Silver Hill Hospital in Connecticut. And we were talking about these denials for not medically necessary. And Dr. Gerber said to me, you know, every health insurance policy says we cover care that is medically necessary. If you were to get a copy of your entire insurance policy, which, by the way, I recommend that you do, it's a document that could be 100 or even 200 or 300 pages long. Somewhere in that document will have the phrase medically necessary or medical necessity. And that's the standard that insurance companies use to determine whether or not they cover care. So what Dr. Gerber said to me is, through all of my training, I was never taught anything about medical necessity. And the reason is because it's a legal term. It's not a clinical term. Clinicians are trained with terms like the ones shown at the left. Do no harm. That's the Hippocratic Oath, which you may have heard of. It's a 2,500-year-old reference from Hippocrates. And it's the, I'll say it's the guiding light for clinical care. Do no harm. We also expect that clinicians are going to be taught to use safe and effective treatment, a phrase that's very familiar to us from buying over-the-counter medicines or even medications for which we require a prescription. And then, and probably most importantly, we expect clinicians are going to use generally accepted standards. And that's what Dr. Gerber said to me. He said, all through my training, we learned about generally accepted standards. It's a clinical concept. We never learned about medical necessity. It's a legal concept. So if you have generally accepted standards on the one side and you have medical necessity standards on the other, it's quite possible that those two different standards are going to result in two separate and different decisions for what the care is that an insurance company should be paying for. So what's the best way to be sure that there's no gap between those two concepts? See if I can. All right, so this is a short video. I was having some technical difficulty earlier. This video is a clip of Dr. Jesse Ehrenfeld, who's the president of the American Medical Association. He's an anesthesiologist by training based in Milwaukee. And in this short video, and I'll include this and I'll make sure it's working in the PDF, and Courtney can send this around to anyone who has interest. Dr. Ehrenfeld describes how an insurance company would not imagine themselves in his operating room deciding what care he may or may not provide. But when it comes to mental health and substance use disorder care, insurance companies seem to have no problem at all getting in the way of care and deciding what care is or is not medically necessary. Well, 4 summers ago, I had the honor of writing an article that was published with several colleagues, Mark Dubofsky, who is a litigator in this area, Eric Placken, who is a psychiatrist who, until the end of last year, was the head of Austin Riggs Center, which is one of the leading psychiatric hospitals in the country in Western Massachusetts, and Cheryl Potts, who's an advocate based in Oak Park. And we wrote this letter called Providing a Routine Medical Necessity Letter to Improve Access to Care for Our Patients. The whole goal of this article was to teach psychiatrists and other clinicians about medical necessity letters. And I'll tell you in a minute a little bit more about these letters. The whole goal of these letters is to close the gap between a medical necessity standard on the one side and clinically generally accepted standards on the other. That's the whole point of these letters. So our website has two different templates. I'll talk first about the main one of a medical necessity letter. This template can be downloaded from our website. It's in Word so that it's easy for a clinician to use. The best way, I think, to think about these medical necessity letters is to think of them as, in writing, a conversation that a clinician might have with an insurance company. And the conversation might go something like this. First, the clinician would introduce themselves. They'd say, "Hi, I'm a Dr. So-and-so, or I'm a psychologist, or I'm a licensed clinical social worker, and I trained at the following institution, and I deal primarily with the following patients and have done so for some number of years." So first, establish your credentials and your credibility. And to describe the summary clinical assessment, which is to say, I've been working with this particular patient, Joe, for some period of time, and here's what I've observed about their clinical condition, and being able to apply my training and experience. Then to specify the generally accepted standards of care that I have relied on based on my judgment and my assessment of Joe's particular clinical condition, and to say specifically how those clinical standards of care were applied. Might also comment on how those clinical standards were applied in light of certain risks that might be specific to the patient, including risks of not providing this kind of care. And then to say, this is the medically necessary course of treatment. So the whole goal is to essentially take any space out from between a standard of medical necessity and clinical standards of care. Now, in some states, these determinations about medical necessity are being required to be made on the basis of generally accepted standards. So that's, I'll say, potentially good news. What is not necessarily true is that even when insurance companies are forced to apply generally accepted standards, that they come out with the same conclusions as clinicians. So that does not remove the need or reduce the potential value of having a medical necessity letter on file with the insurance company. I can say that for our own family, we had two different medical necessity letters from two different clinicians, and that those documents of what care was or was not medically necessary played an extremely crucial role in our being successful overturning the denials ultimately and winning the lawsuit. So another example of an obstacle besides medical necessity letter denials that are based on standards of care could be related to frequency of care. So last November, ProPublica published an article about United Health essentially calling up clinicians, whether they were all outpatient clinicians. Some were psychiatrists, some were psychologists, others were therapists of like licensed clinical social workers and the like, and saying essentially, why do you have to see this patient twice a week? Or why do you have to see them all for such a long period of time? Why is this frequency of care appropriate? Well, as soon as I saw this article, I thought immediately, this is an occasion for a medical necessity letter, because this is an example where the insurance company is thinking they've got the standard figured out on the one side of what's medically necessary or not, and the clinician who's taking care of the patient has a different view based on their experience. So with that in mind, we created a very, I'll say, short and sweet template for clinicians to be able to use to respond to this kind of interruption by an insurance company saying, I'm trained in this area, I've been practicing for a certain period of time, have been working with this particular patient for a period of time, and the particular frequency of care and or duration of care is appropriate to their treatment. And so this is I'll say a different example of a medical necessity letter that a clinician can use to advocate for their patient in writing directly in response in a very common sense way to the insurance company trying to block the care. So a friend of mine has a sister who has extreme anxiety about being in a car. And as I'll say, as fate would have it, she ended up in a car accident, and she was injured somewhat and required care for some not life-threatening physical injuries, and at least as significantly, maybe more so, this anxiety about traveling in cars was really exacerbated. And so she was telling her sister that she was really concerned that she was going to need to go back to her therapist and get some more treatment, having been in this car accident. And her sister said, if you're really worried the insurance company is going to get in the way, because that was certainly the sentiment that her sister had said to her, that she was quite concerned the insurance company was going to be dragging their feet. She said, why don't you go to this website, covermymentalhealth.org, and you'll see a medical necessity letter template. You can provide this to your therapist, and you can submit it to your insurance company. And that's exactly what my friend's sister did. And she then submitted the letter, and the insurance company said, we approve the care. And she sent me a short email, excerpts of which are included here, about how she sent this medical necessity letter off to her insurance company, and they reimbursed me for mental health services. I'll say no further questions asked. So these letters really do work. Here's another example. This is from a clinician who works in substance use care in Illinois. She and I had a conversation. We were introduced through a mutual friend, and we were discussing my having a potential workshop with her and her clinical colleagues. And so we were, I'll say, in between that conversation and getting something scheduled, and she ended up getting a denial from an insurance company about a particular medication that she had prescribed for a patient of hers who was suffering from substance use disorder and was keen to go into recovery. And this clinician had a very clear judgment about which medication was required, and the insurance company said, no, we're not going to approve that medication because it's only appropriate if the patient is completely abstinent, so completely off of alcohol, and is completely stabilized. And this clinician knew that was just not true, that this medication was completely appropriate for someone who was weaning themselves off of alcohol and was on a path to abstinence, but did not necessarily need to be abstinent. And so, as she described to me in an email, she went to our website, downloaded the template, included the specifics for her patient, and submitted to the insurance company. And after having gone through appeals and other denials of prior authorization, she got the approval, and her patient was then in a position to get the prescription filled and get on with their recovery. So it's obviously a great story of insurance companies, I'll say, getting the message that the clinician knew exactly what to do and knew the language in which to communicate, and the care could proceed. So let's talk a little bit about the last of the arrows from the beginning of our workshop, which is that we expect claims are going to get paid and there'll be disputes resolved in a way that's supportive of the patient. So again, if we were to stop and think about what we would expect, we would say, well, we don't know what to expect. We just don't want to be surprised, which is a perfectly reasonable expectation. But what we know is that denials of not medically necessary happen, that prior authorizations that are given can be withdrawn, which is certainly that's happened to our family, where we had care that was pre-authorized and we submitted the claims, and then the insurance company said, just kidding, we're going to pay for part of the care but not all of the care. So these are the sort of surprises that we that are just completely confounding and suck up a lot of energy, and that we want to try to figure out how to overcome. So I want to talk about a few specific examples of steps that can be taken before an appeal. So when I talk about before an appeal, if you were to look in your health insurance policy, somewhere you would find a reference that says something like, if you have any dispute with us about a claim not being paid, you can file an appeal. And that's true, you can do that. Of course, if you can't find a clinician who's in your network, who's nearby and soon and competent, then there's never even a claim to dispute. So an appeal actually is not even appropriate, and there's no obvious way to dispute a claim that has failed to happen because you've been denied any care at all, even access to the right clinician. So taking steps before an appeal are really important. So let's talk about a few of the steps that are available. So the first one I want to talk about is requesting a copy of your claims file. And I've done this a couple times myself, and I can say this also can be extremely useful. So it's funny where this comes from. So we think of HIPAA as the law that says our confidential health information cannot be shared with anyone. So if you've started with a new clinician anytime recently, you've probably had to fill out a form or at least sign a form. Maybe you read it. I don't think I've actually ever read one of these that says that the clinician complies with HIPAA and is going to take care of your health information. It turns out that another part of the HIPAA law says that you can ask your health insurance company for a copy of your complete claims file. And by complete, I mean everything. So the request can be made using the template that you can download from our website. You can also certainly make it over the phone. And even if you make it over the phone, I think it's really important to also do it in writing to be sure that it's documented what date you submitted it, because there's an obligation of 30 days that an insurance company has to respond. They can get an extension for another 30, but they have to provide you with this information. So what's going to come back? So they're going to probably provide you with a lot of information you already have. They might provide you with a copy of your insurance policy, which, as I mentioned earlier, could be 100 or even a couple hundred pages long. They'll probably also give you copies back of explanation of benefits, EOBs that you have, or prior authorizations that you also have. But there may be documents there that you do not have. For example, call logs. And those could be internal call logs where outside experts are providing advice to the insurance company about what care is medically necessary. There could also be written reports that those outside experts have provided to the insurance company that you're entitled to get a copy of. And it could also be that an insurance company has said that care is not medically necessary, but you get a copy of the complete claims file and there's no documentation to support that the care is not medically necessary. So it could be by virtue of what's missing that it's helpful to make this request. I certainly encourage you to ask for a copy of your claims file. You can do this anytime you want. Probably doesn't make sense to do it, I'll say, on a monthly basis, but it might make sense to do it when there's a change in level of care or there's some change in the status of your, in terms of clinical condition, that might cause an insurance company to deny you care. Let's talk next about a formal insurer complaint. So it turns out that a formal complaint filed to an insurance company is a step that you can take that might help get attention that can't be gotten any other way. Let me first say what it is not, then I'll say what it is, and then I'll tell you why it's important. So it is not a regulator complaint, it's an insurer complaint. And It's also not an appeal. It's a complaint. And it goes like this. If you're talking to an insurance customer service rep, you would say, I want to file a formal complaint. This complaint is for a quality of care failure. Those are the key phrases. And then we, as I mentioned earlier, we always encourage that you follow it up with with something in writing. And there's a brief template on our website that you can download to accomplish that. So that's what it isn't and what it is. So why is it important? Well, it turns out that insurance companies have to treat formal complaints in a special way. They are obliged to report formal complaints to their regulatory authority and to their accreditation agency. So insurance companies have to be accredited to be able to do business as insurers. And when you file a formal complaint, they have to begin tracking it right away as a complaint so that at the end of the year or the end of the quarter, whenever they have to file their notice, that they've kept track of the complaint that was received and how it was handled. And so that's a way of getting the insurance company's attention because they have to track it and they don't like that. And they also don't like to have to report to their accreditation body or the regulator that they just said no again, because that just does not look good to their regulators or their accreditation bodies. So that's, I'll say that's good for you. And if the complaint can also include that you've provided a medical necessity letter or that you have had other conversations with the insurance company and they have not followed through, those are also important bits of information to include in a formal complaint. So it can also be that you can find help from the government. So constituent services is I think the most potentially interesting one. And the idea there is to call an elected official. So to call your state rep or state senator. You can also call your US senator or member of the House of Representatives. The offices of these elected officials will include someone whose job is to talk to their constituents and to help them. And I was giving this presentation at the NAMI Texas annual meeting last fall in El Paso. And when I mentioned that, this woman in the back stood up and raised her hand. And so I asked her what question she had. And she said, well, I just wanted to say that this is exactly right. That it was, she said, that's my job. She said, my job is in the state house in Texas, and I work for a certain representative, and I take calls from our constituents, and they tell me what issues they have with all sorts of different things, including health insurance. And she said, I've had problems with insurers covering mental health myself. And so when someone calls me with an issue like that, I can listen to them. I listen to what steps they've already taken, and then I call the insurance company. And she said, I usually get good results resolving the issue in the favor of the constituent within a couple of days. So on our website, you can find a video that I took of her afterwards. I asked her if she would share that wisdom, and I took a video of her that you can find on our website. She's just exactly the sort of advocate that you'd want to be able to find by calling constituent services. You can also call state insurance regulators or in some cases the Department of Labor. And there's information here and also on our website about how to accomplish that. You can file an appeal as described in the insurance company, and we don't provide a template for this because the appeal that you file is I'll say effectively a legal action. So it's important to take these with, I'll say, a little bit more seriousness because you might get just one chance to provide all the evidence. And so you want to do that with, I'll say, full recognition that there may be legal consequences to getting it right. This is your opportunity to provide all the evidence required. So in the same way that the claims request might deliver a whole lot of information, some of which you know that both sides have, I think it's important to include all that documentation in your appeal to be sure that everything is there that might need to be considered as part of the appeal review process, and maybe any follow-up steps beyond an appeal. Okay, let's start to take some questions. So I just want to maybe summarize the workshop so far, which is your reasonable health insurance expectations are just that, they're quite reasonable. And that our website can provide you with encouragement and resources to not take no for an answer. That medical necessities letters are a really important way for a clinician to assert their authority for determining what a patient's appropriate treatment is. That there are advocates available, friends and family, government. In some cases, it could be that your employer can also provide help in reaching out to someone. Could be in human resources, or it could be in some companies, it could be someone among the top executives who has told you how important mental health is to the company. And this might be an opportunity to say, my health plan, our health plan is not working out so well. And then that there are lots of steps that you can take if at first you don't succeed. So I see there's one question in the chat, and then you can open it up and see if there are others as well. So the question is, will the medical necessity letter work for getting insurance companies to pay for long-acting injectable medications for mental health? So the answer is that that medical necessity letters should be effective in getting access to care, or the care that a clinician has determined is the right one. And in fact, I was talking to and so that could be long-acting injectables, or it could be other medications, or it could be intensive outpatient. All those, as long as the clinician is following generally accepted standards, then it is completely appropriate that a medical necessity letter can secure coverage for injectable medications. So let me tell one story that I heard from a psychiatrist. She's the head of psychiatry at a teaching hospital in the Midwest. And she told me that she had exactly this issue. She was working with a young woman who had bipolar disease, and the medication of choice was a long-acting injectable, and the insurance company was getting in the way and saying, no, we're not going to permit that. And it was a conversation around medical necessity that, so this was not using our template letter because it happened about a year before we launched the website. But as I made a presentation at this particular teaching hospital, she told me the story that when she went back to the basics, which is to say generally accepted standards, the insurance company stood down from their objection, and this patient of hers was able to get the long-acting injectable approved. So absolutely, this can work that way.
That's great. Yeah. Yeah, please feel free to put questions in the chat or the Q&A.
Okay, so next question. When calling an insurance company, is there a specific group within each company that is recommended to ask to speak that focuses on mental health cases versus speaking to a general customer service rep? So I'll answer this in a general way, because different insurance companies handle mental health and substance use disorder care sometimes differently. The way I think about it is this: if the insurance company has a phone number on the back of your card, you're entitled to call it and begin to talk to someone about the issue. It's really their problem, not yours, as to whether the person who you're talking to is competent to handle the call. And so you should say, take their lead. If they say, you really need to talk to someone in our behavioral health area, then fair enough. You can say, well, let's transfer the call to someone else. And then again, make a note of who you spoke with, the date, what you talked about. And as I said, I always like to get the ID number from the person. Sometimes they'll give you a call reference number. But it's up to them who they have you talk to. And if it happens that you're speaking with a generalist about something and they give you some feedback, and I've experienced this myself, where you get some feedback and they say, oh yeah, that is definitely covered. Say, okay, great. So let me just double check. So your name is Joe, and we're talking about my son or daughter and so on. Okay, thanks very much. I really appreciate it. That is something that you can rely on and something that you could document back in a letter if you were concerned. It's not really your problem that they put somebody on the line who was not authorized to tell you that. Now, that's not to say that they're not going to give you some trouble later on, but it's not up to you to chase down exactly the right person and to double, super, triple check that they're authorized to tell you that. That's their problem. Have you had success getting insurance companies to pay for residential treatment, particularly when it's out of state? Right. So for sure, higher levels of care, like residential care, can be challenging. So let me describe how this can work, which is not to say that it's going to work every time. So this is a question that is, I'll say in a way, a combination of, is there an in-network clinician who is competent, nearby, and available soon, and that you've got agreement about what care is medically necessary. So let's take the first one. So, excuse me, if the let's say that if it's residential treatment, it's probably being recommended by a psychiatrist or some other, I'll say some other similarly competent clinician. And so that clinician can document the care that is required in a medical necessity letter. And even if the care that is to be provided, that is appropriate based on their experience, training, and observation of the patient, is, let's say that care is going to be provided by someone else. That's okay. They are still competent to make that determination and to write a medical necessity letter that says, this particular patient, Joe, really needs to be in a residential program. Great. So that's a way of establishing what the need is. Now the question is there a residential program that is available now, or as soon as the clinician has determined care is needed, and is nearby? So here's where it's going to get tricky, right? Because there isn't necessarily a residential program available that's appropriate within, I'll say 30 minutes of your house. It could be that it's a program that's out of state. And an insurance company might say, well, we have a series of programs that are available. They're not residential, they're intensive outpatient, but we think they're good enough. So the medical necessity letter is the evidence to say, no, that's not what we're talking about. We're talking about, we're looking for a program that has residential care. So then they might say, well, there is a residential program. So first you'd want to make sure that it truly offers residential care for the right symptoms, that it has the right treatment modalities that are appropriate for the care, including, by the way, an initial evaluation that may be appropriate. And this might be one where the insurance company and the clinician who's making the referral don't agree on the suitability. So that's one that the clinician may be quite helpful with. And if the program is, there is no program that's in network, and you've found a program that's out of state, then that's a conversation to have with the insurance company to request a waiver. So again, that's not necessarily a simple path or a quick path, but that's say it's a fact-based way that the clinician can help you. Medical necessity letter conversation with the insurance company. Now, Illinois has enacted some laws that require the cost of transportation to be paid when care is not available nearby. Now, the specific applicability of that and the enforceability of that is beyond the scope of what certainly what I'm prepared to talk about today. But there is definitely it's fair and a reasonable expectation that an insurance company should pay for residential treatment when it's medically necessary and there is no in-network option available. I hope that's helpful. I wish it was as easy as, oh yeah, of course we don't have anyone available in network, and of course we're just going to pay for it. And it may not be that straightforward. but the follow-up steps of formal insurer complaint or talking to a constituent services person, those are definitely steps that can be helpful. And this is also a very, very well-known area where insurance companies stand in the way. And I'll say an informed and common sense-based request is much more likely to be accepted than no request at all. Any other questions coming through the chat? So I put in the chat right at the beginning my email address. It's joe@covermymentalhealth.com. So our website is .org. You can certainly contact me later. Okay, we got a new question. Would a medical necessity letter have to be provided by a psychiatrist providing ongoing care to a loved one if a psychiatrist performed an evaluation when a loved one is in jail who made a treatment recommendation? Can they be asked to provide a medically necessary letter? So the answer to that question, I'll say more broadly, is clinicians who are in a position to provide feedback are the right clinicians to provide a medical necessity letter. So certainly if the initial recommendation was made while someone was in jail, that's certainly an appropriate person to provide a medical necessity letter. It doesn't mean that they are the only or the only forever person who would provide one. But that is certainly, that's important. That's important advice. The way I talk about it with clinicians is that medical necessity letters can be used in for a variety of different occasions. Certainly when you get a denial, you can provide one. But also when a denial is lurking, and we know that denials are lurking when there's a change in level of care or a change in location of care. So if someone was in jail and getting, I'll say, whatever care might be available there, and they're going to be moving to a residential program or intensive outpatient, that's an inflection point where having a medical necessity letter as part of that handoff, you could say, to the next level can be very, very helpful. By the way, our website has a link to that article from 2021 in the Journal of Psychiatric Practice. And what I've had any number of families tell me is that they sometimes will say to their clinician, by the way, I'd like a medical necessity letter, and you can find a template on this website. And here's a copy of an article from the Journal of Psychiatric Practice, in case you're wondering if this is even a thing, because the answer is, it is absolutely a thing. And that might be encouraging also. These templates, I mean, what we hear from clinicians is they don't want to spend any time doing anything more than they have to. Insurance companies make them crazy. And what we have learned to say, and we have found that it is really appreciated, is that they already spend a lot of time dealing with insurance companies, and having a template that's ready to go, that they can modify to the specific situation, that might be more than they spent previously. It's less time than they're going to spend with the insurance company. And when they write a second medical necessity letter for another patient, it's going to go so fast, it's going to become routine, and it's going to help their patients. And the feedback we get is it actually works.
That's great. Thank you so much, Joe. This was really, really helpful. And thank you everyone for joining. Yeah, Joe gave his information and his website, so please feel free to use those resources. Just to close, if you enjoyed our program, you can learn about our upcoming programs and events on our website, which is namiccns.org. Our next webinar will be August 20th from 7 to 8:30 p.m., where we'll be joined by Start Early and Erickson Institute, where we'll talk about defining and understanding infant and early childhood mental health. We have a program on August 6th, which is called Family Insight Evenings. More information can be found on our website if you'd like to join for that. And then once you log off, you'll see a brief survey that will allow both me and Joe to better understand your comfort level with today's topic and provide us with information that we need to raise money to continue providing free mental health services and just to understand how you enjoyed tonight's webinar. So please feel free to take the time to complete that survey. We'd really appreciate it. Yeah, so thank you so much for joining us tonight, and we look forward to seeing you at the next webinar. Please take care of yourself and each other. Thank you so much for joining us, Joe. This was really helpful.
Thanks very much, everyone, and have a good evening, and spread the good word about the work that NAMI Cook County North Suburban does. They are a remarkable organization, and share with folks who might benefit from it our URL and our resources, and have a good evening.
Great. Thank you.